because in the lecture, there's 48 of you, in the lab, it's only 24 of you, and it's better to have 24 people complain at you before you Alright. So, I'm gonna go over everything, and then we're gonna show you a label, okay? So you can hear me and just look at it, and then we'll show you the parts, okay? So this here is the shoulder girdle. So the shoulder girdle is gonna consist of the clavicle or collarbone and scapula or shoulder blade, okay? And also your arm bone, which is the humerus, okay? So if you're looking at this anterior, this is posterior. So anytime you're looking at a picture, X-ray, MRI, CT scan, always get your bearings, know what you're looking at. You know what you're looking at. It's gonna be anterior, goes to clavicles in the front. This is posterior, because the spine and scapulas in the back, okay? So on the medial side, right, you got your clavicle, you got your sternal end, which is medial, and your acromial end that is lateral, okay? So if you look, that's what you need to know for that. But if you're looking at your scapula here, okay, on the posterior, you got a spine and a scapula. And you can palpate that, you can feel that little bump, right, on the back of both your shoulders. So you're coming around here, and it makes a turn, okay? That's called the acromion or acromion process. In older words, acromion process, I still use that as a process, it's something that sticks out, okay? So it makes life a little easier, okay? So if you make your acromial clavicular joint, when you do joints, we don't even really go over ligaments, because ligaments attach bone to bone, okay? So the acromial clavicular ligament locks these two bones together, okay? So the ligament's named for two bones holding together, so it's actually fairly simple, okay? So you have an acromial process here, okay? So when you tear that acromial clavicular ligament, okay, you can separate this, called an AC separation, or acromial clavicular separation. That's what they're talking about, okay? All right, so now, you got the spinous scapula here. Above the spinous scapula is, so we have shallow depressions, okay? Shallow depressions called the fossa. So on the top of the spinous scapula, you have a suprascapular fossa. It tells you, suprascapular fossa, okay? Infrascapular fossa is below the spine, okay? And then anterior, it's called the subscapular fossa, okay? So you get supra above, infra below, and sub, okay, and the scapular fossa, scapula, okay? These are important because we do muscles. The muscles of your rotator cuff are located here, push your shoulder around. So if somebody has a rotator cuff tear, it's one of these muscles, okay? So the rotator cuff muscles are supraspinatus, infraspinatus, subscapularis, and right here, in the like this, called the paraspine. Okay, we'll do that, we do muscles. Okay, got a little like that. Wait, so we have a medial or vertebral border, this is a vertebrae, medial or vertebral border, and a lateral or axillary border, it's under the arm. Okay, it is right here. And then we have a superior angle and an inferior angle. That's basically it for the scapula. Okay, the humerus here, so anteriorly, right under the acromial process, you have a coracoid process. So it's two C's. Coracoid looks like a C. Okay, so muscle attachment attaches here. Okay, so for example, your coracobrachialis muscle, which you do this. Okay, all right, and then you have this little cavity here. Okay, glenoid cavity. Okay, it's a socket. It's a cup, right? And a humeral head goes in there. It's round, so it makes a ball and socket joint. Okay, so you got the head of the humerus here making contact with the glenoid cavity, and they're covered in articular cartilage. Okay, which type of cartilage. Okay, so you got the humeral head, then you got the neck. You got the neck right here. Then you got these rounded projections. It's called the greater and lesser tubercles. The tubercles are rounded projections. Okay, and then you got this groove, okay, in between the tubercles. Okay, so what do we call the groove? We call it a sulcus, right? So it's called the intertubercular, right, in between the tubercles, intertubercular sulcus, okay? They also call it the bicipital groove because the long head of biceps brachii tendon goes right through there and attaches to the glenoid cavity, okay? All right, we can do this. All right, if we go distally, you can get a little bump here. That's called the deltoid tuberosity. Deltoid muscle attaches here, okay? Deltoid muscle attaches right here. So deltoid muscle originates, right, starts right at the clavicle and spinous scapula and wraps all the way around, this is right here, wraps all the way around the deltoid tuberosity. Okay, so it's important to know the bones and the parts, because the muscles attached to them, okay? All right, so let's look at this again with it labeled. So, right, clavicula, sternal extremity, right, or sternal end goes to the sternum, and then acromial extremity or end that goes to the acromial process, right, or posterior. Okay, so here's again my scapula. So you got the spine of the scapula. Coming on the front here, you got your acromion or acromial process. Then you got the supraspinous fossa above the spine of the scapula, infraspinous fossa, right, on the bottom of the spine of the scapula, and then anterior subscapular fossa. It's underneath. Think of it as at the end of it. Okay? The only way to know this stuff, just keep going over it. Let's keep reviewing it. Okay, so right here, you got the vertebral end or medial and lateral end or axillary portion, okay? And right here is the glenoid cavity. So you know right now, if you're looking at this, this is a right scapula. This is a right scapula. How do you know? It says it right there, right now. Right here, it's the right scapula, because your arms gotta go in. Your arms go in on the lateral side. They can't come in on the medial side, you won't be able to move them. They come in on the lateral side. So this is posterior, that's the lateral. Okay, it's the opposite way, it's the left. Okay? You're looking at this, you same thing, right? It's gonna be a right scapula, because the arm comes in this way, it's an anterior. Okay? Okay, so you got your superior angle, and then you got your inferior angle. Okay, if you're looking like a lateral view, like right here, that's your glenoid cavity. So the head of the humerus goes into that, and it's covered with cartilage. Anterior side, you got a coracoid process. It looks like a C almost, okay? Because in your elbow, you got a coronoid process. Kind of looks like an upside down lowercase n, okay? All right. Good. So now we're here in the upper extremity, so we've got the humerus here. Same thing, I'm gonna go over the parts and then we'll label. Okay, so right here is the head of the humerus again, right? Makes a ball and socket joint with the glenoid cavity. Then right here, it's called the neck. Okay, it's the neck. Greater tubercle, lesser tubercle, intertubercular sulcus, or bicipital groove, and then you got your deltoid tuberosity. Okay, right underneath the tubercles, that area is, surgeons gave it a name. They gave it like a nickname. Yeah, they call this the surgical neck. This would be the anatomical neck. This is like a made-up area. Okay, called the surgical neck. Statistically speaking, this is the most broken part of any bone. Somebody falls, they stick their arm out and they snap it. Yeah, that's why it's called the surgical neck. Okay, if we go distally, right? We're making a joint here. We're making a joint with the humerus, okay, the arm and the forearm bones, okay, the radius and all that. So when we make a joint, just like we have occipital condyles, they make a joint, right, with C1, okay? Well, we have condyles in the elbow joint and the knee joint, okay? So these are called, right, lateral and medial condyles. By the upper extremity, we give those condyles names, okay? So the lateral condyle, right, we're in the anatomical position, it's the right arm, okay? We have the capitulum and the trochlea. So the condyles have a name, capitulum and trochlea. Okay, above that, right here and right here, these are called epicondyles because they're above the condyles, the ligamentous attachment. Okay, the ligamentous attachment. And then the lateral bone in the forearm's the radius, the medial bone's the ulna. Okay, so it's like a peak. Right, so again, right, one more time, right, just like the third time we're doing it. So, right, head of the humerus, neck of the humerus. Okay, so we call it the anatomical neck. Greater tubercle, lesser tubercle, intertubercular sulcus, okay? And then over here, this made up name here is gonna be called the surgical neck, Go distally, right? Deltoid tuberosity for the deltoid muscle. Keep going distally. On the lateral side, the condyle is called the capitulum, medial side is called the trochlea, and then we have a lateral epicondyle, and then we have a medial epicondyle. In the next chapter, we'll talk about the ligaments, we'll talk about epicondylitis, okay? Medial epicondylitis. Okay, one's tennis elbow, one's golfer's elbow. Okay? All right, so now, if we're looking here, right, so we've got the radius and the ulna. This is the head of the radius here. So the head of the radius makes contact with the capitulum. And what locks it in place is called an annular ligament. So what the radius does when when the muscles contract, it rolls over the ulna. So when we do joints, we go to over the action with supination and pronation. We supinate a muscle, the supination, pronate a quadratus and teres muscles with pronation. Okay, all right. Okay, so so it rolls. But now right here, right, so where the ulna is, the medial bone, right, it does flexion extension, okay? So right here, where the trochlea is, we have a coronoid process. So it kind of looks like an upside down N, like a lowercase n, it's upside down. Okay, so coronoid process. So now, in posterior, coming down posterior, okay, got this little hole here. Okay, so if you go down your humerus, you bend it a little bit, you can push your finger in there. That's that little hole. It's called the olecranon fossa. Okay? So what goes into olecranon fossa is the olecranon process. Okay, again, I'm just calling it olecranon. So olecranon process, it fits in there, makes a hinge joint, for you. Okay, makes a hinge joint. Okay, so that's important. And how I basically asking on the test, okay, what makes up the elbow joint? The olecranon. Well, olecranon process, and it fits in olecranon fossa. Okay? All right. Okay, so if we're looking here, okay, so one more time, right? So we have the lateral arm, the lateral bone of the arm. Just think, it's a radius. It radiates to the thumb. Remember, everything's anatomical position. So it radiates to the thumb. So we got the head here, okay? And we go distally, we got the styloid process, okay? It's for muscle attachment. Don't worry about the radial tuberosity. Don't worry about the nutrient foramen. That's just blood supply going there, okay? Okay, but worry about like the medial bone of the forearm, okay, is the ulna, and the front or anterior coronoid process, and the back olecranon process. If we go distally, right, we have the head and the styloid process. Okay, right? What you could say something. That was this thing. Didn't say something back. I was thinking, I wonder what my wife made me for lunch today. They have interactions, membrane here. It'll come. Okay, then we have our carpal bones. Carpal bones are wrist bones with 8 wrist bones, 4 on the top and 4 on the bottom. Okay, can we have metacarpals or our hand bones, right? They're covered with skin and interosseous muscles in between. And then the fingers are the phalanges of the upper extremity, because your toes would be the phalanges of the lower extremity. Okay, just go like that. Don't worry about that. We gotta look at these. Okay. What did I just do? We're done. I look a little baby critter. Those are fine now. There we go. Okay. There it is. All right, so when you name the carpal bones, when you name the carpal bones, remember you're always in the anatomical position, okay? What is with this thing? We're always in the anatomical position. Okay. Go to the thumb side first, the thumb side, okay? Right here at the top row, okay? So it goes scaphoid, lunate, triquetrum, pisiform. Scaphoid, lunate, triquetrum, pisiform. The lunate looks like a half moon. The pisiform means P in Latin. It looks like a P. Okay, it looks like a P. Okay? Then you go back to, right, the thumb side, do the distal row. Okay? So you know what trapeze in the circus, right? You need a thumb to grab the trapeze, right? So the thumb side, right? You got a trapezium, trapezoid, capitate, and hamate. Capitate's the big bone. Big bone. The hamate's got a hook on it. So when we look at the skeleton, you see it's the hook of the hamate. Okay? So you grab a trapeze with a trapezium, trapezoid, big capitate, hamate's got the hook. Okay? So if you're in a tense situation, you think you're gonna forget, right? So you write that, right? So it's scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Okay, I'm gonna give you a little mnemonic now, okay? You ready? You ready? Okay. Some lovers try positions that they can't handle. It hurt your back.
Do you?
Huh?
Do you?
Dude, I have a great back. There's nothing friggin' wrong with my back, big guy. Yeah. In the paper news, you're hearing about same-sex marriages. I'd settle for a some-sex marriage at this point. Actually, it was funny. So we were in my practice one time. We had this guy. We actually found cancer in the side. He passed. But before, a very cool guy. And he'd come in with his wife. She's a little bit of a thing. So he used to tease her all the time. His wife, and he said, he goes, I know why my back bothers me all the time. He goes, sex knocks your back out, right? He goes, and he said his wife gives him sweet loving all the time, and that's why he's got a bad back, right? So that morning, my office manager, and they're like in their 80s now, her husband Ronnie, he had hurt his back real bad. And he was walking across the street to get to the office, he could just about walk. He's like dragging a leg. So he came in, we popped it back in, he was like almost immediately fine, So this guy Brett was telling me, he goes, you're saying that, having sex and making sweet love with your wife and knock your back out of alignment, right? And I go, there's nothing wrong with my back. My back's fine. My office manager sticks her head in the door and goes, Ronnie couldn't even walk today. Get it? So that's in the mind.
Are these the knuckles?
These are your wrist bones. These are the wrist bones right here. Those are your wrist bones. We'll do this. Okay, it's condyloid joint. These are your wrist bones. So now we're going to go over your hand bones. These are your hand bones in here. So if you feel them, right, the palpate, they're individual bones in there. They're long, okay? These are long. They're just covered with skin. You have muscles in between them, okay? Interosseous muscle, and you got your lumbricals in there too, okay? So we're naming these. Okay, these are real difficult to know, so you got to pay attention. Okay, you ready? Okay, ready? No?
Okay, I'm ready.
You're right. These are kind of difficult. I don't know why they make it so difficult. So start off at the thumb side, okay, and they're named like this, okay? Metatarsal 1, 2, 3, 4, and 5. That's okay. Right. But they all have a base, a shaft, and a head. Let me show you. A base, a shaft, and a head. So base, shaft, head, base, shaft, head. So the base is the proximal portion. The head's the distal. So I'll ask, I'll say, what's the base of a phalange? What's the base of the metacarpal? Well, you can tell me, I'll say, what would be the proximal portion? Tell me the base. If I ask the distal portion, tell me the head. Okay? Okay, phalanges, same thing. Start off at the thumb side, 1, 2, 3, 4, and 5. Okay? But now the thumb has two bones, a proximal and distal bone. Okay, all the other fingers have proximal, middle, and distal bones. Proximal, middle, distal. And they all have a base shaft ahead. Even the distal bone and the fifth phalange, okay? That would be the tip of your pinky as a base, a shaft, and a head, okay? If we're talking about the joints, okay, the joints here, where you have a proximal interphalangeal joint, that would be the knuckles, okay? Proximal interphalangeal joint, middle interphalangeal joint, and a distal interphalangeal joint. So you have a pip joint, a mip joint, and a dip joint, just for short. So if you're playing basketball or volleyball, if someone comes in and they jam their finger or they dislocate it, you say they dislocated like the dip joint if it was a distal joint. Okay? All right. But it's important to notice. And look, they're all covered with articulocarp, right? Okay. Now we're going into the lower extremity now. The lower extremity. Okay? This is an anterior view. This is an anterior view. This here is a female pelvis. Okay, if you're looking at how wide it is here, okay, and look at how the tops of the iliums are. Okay, they're very, very flat, very broad. Okay, this here would be a male. You see the space here and here, and look here, these are closer together. Okay, this is for having babies. This is for having babies. Okay, all right. The top bones in the pelvis, okay, they're called the iliums. Okay, that's where your belt would sit. Okay, so the superior bones in the pelvis are the iliums. Okay, the anterior bones are the pubic bones. Okay, and the posterior bones are your ischial bones. Okay, you're sitting on those right now. Okay, when they made the book, they put hip bone. These are not hip bone. It's a hip joint. It's right here. Okay, so this is inaccurate. So if you call your iliums a hip bone in your programs, they're going to yell at you. Okay, so don't call them. Okay, the thing is, if you put a picture in a book, even though we're like the 100th edition of this book, if they change a picture, it's incredibly expensive, so they just look at it. Okay, so the top bone's gonna be the ilium, anterior bone's the pubic bone, posterior bone's the ischium. These three bones come together, and they make a socket, okay, where your thigh bone goes into the femur head, okay, it's called the acetabulum, Okay, so we're gonna show you with everything all, labeled. Okay, so this is the sacrum, it's vertebral column, it comes in, and it makes a joint with both iliums, right? It's called the sacroiliac joint, okay? Now, we have a hole in the pelvis on either side, okay? It's called the obturator foramen. Yeah, the obturator nerve runs right down next to that, okay? The obturator nerve innervates the muscles that make you adduct the legs. Adductus longus, magnus brevis, and gracilis, okay? All right. So if you're looking at, again, I'm gonna show you the pictures, we're gonna talk about it, then we're gonna show you all later, okay? All right, so the top bone again is the ilium. And like on the lab test, that's exactly how I ask it. What's the superior bone in the pelvis? You write in ilium, okay? What is the anterior bone, okay, in the pelvis? You're writing pubic, okay? You can write pubic, you can write pubic bone, doesn't matter, same thing, okay? And I said, what's the inferior bone? Okay, you're gonna tell me, ischium, okay, tell me you're in ischium, okay? So pretty easy. These three bones come together, and they make up an acetabulum, it's a cup, okay? You have a foveus capitis ligament that locks the, joint together, okay? All right, so if you look at the very top of the ilium, this is gonna be called the iliac crest, Then you come around to the anterior side. Okay, this is the right pelvis because the right leg is bigger. And just like I showed you. So you got this bump right here. That's going to be the anterior superior iliac spine. Go from the lower anterior inferior iliac spine. Go to the back of posterior superior iliac spine, posterior inferior iliac spine. Okay, so all four are called iliac spine. All four are iliac spine. If you're in the front, it's anterior. If you're in the back, it's posterior. So either anterior iliac spine or posterior iliac spine, right? Pretty easy. Okay, if it's the one on the top, it's superior. So you're anterior, superior iliac spine. The one on the bottom, right? Still anterior, still iliac spine. Anterior, inferior iliac spine. Okay, posterior, it's iliac spine. Posterior, superior, posterior, inferior, they're both iliac spines. Really not too bad, right? Not too bad. Okay, so you got a big notch here. Greater sciatic notch. You got a little one. Lesser sciatic notch. Spine of the ischium right here, or ischial spine, depending on what you're doing. So greater sciatic notch, lesser sciatic notch. Sciatic nerve runs right next to this. Okay, sciatic nerve innervates your hamstring muscles. Okay, so the membranosus and tendinosus, biceps femoris. Okay? Right. Right here is your ischium, the red bone's the ischium, and these are your ischial tuberosities. Okay, gluteal muscles attached there. Then the anterior bone is the pubic bone, as the pubic tubercle. Big holes, the obturator foramen. That's really what we want you to know for those. You know, whoops. Okay, now it's all labeled for us. Okay, so top part here, right? Iliac crest, anterior superior iliac spine, anterior inferior iliac spine. So posterior superior iliac spine, posterior inferior iliac spine. Greater sciatic notch, lesser sciatic notch, ischial spine. Yes, again, why this is important, okay, there's a disease called Paget's disease, okay? It's a type of bone cancer. And the first sign and symptom, a person's hat doesn't fit anymore. Their shoes don't fit anymore because you're laying down new bone, okay? So it's just regenerating bone very, very fast. We take an x-ray and we'll have a halo right here. They're growing at the top of that iliac crest, growing more bone. Okay, and then you take a bone biopsy and that's it. Okay? The red bone is the ischial bone, so here's the ischial tuberosity here. Okay? The hole is the obturator foramen, anterior bone is the pubic bone, okay, and the pubic tubercle you have here. That's really all you need to know with those, okay? Don't worry about the ala and all this other stuff, don't worry about that, okay? All right. Okay, this is the pelvic brim, it's just a big hole here, don't worry about that. Okay, they have it in the book. So the true pelvis is, you go most anterior portion of S1, right? Sacrum 1, it's called the sacral promontory. Okay, then you go to the most distal portion or inferior portion of the coccyx bone, and you draw imaginary lines to the top or superior and inferior portion of pubic symphysis. Okay, all in there is a true pelvis. Everything above is a false pelvis. We don't test you on that. Okay, all right. Now we got the lower extremity. Okay, yeah, we'll go over it and I'll show you it later. Okay, so right here we got our acetabulum, right? The three pelvic bones come together, they make a socket. Okay, the head of the femur fits in that socket, right? It's ball and socket joint, just like in the shoulder. Okay, so if you have the head, you have a neck. Okay, it's the neck of the femur right here. So when somebody breaks their hip, you're not breaking the hip. Okay, you can't break a joint, you dislocate a joint. But when you're breaking here is the neck of the femur. Okay, now this is a pretty dense bone. Okay, and that's locked in pretty good. But if you have enough trauma to break that bone, you're probably going to dislocate the joint also. It's called a fracture dislocation. Okay, now people break the hips all the time, older people, because of osteoporosis. And a lot of times, like to say, they fell down the stairs and broke their hip. You talk to the person, they go, I was walking down the stairs and a weight snapped it, that's what made me fall down. Okay? Yeah, but of course you can fall down and break the hip down the stairs, there's the trauma too. So you have a head, a neck. Here, these are rougher projections, so they're not called tubercles, they're called trochanters. So we got a greater trochanter here and a lesser trochanter here. Right here, this thing is called the intertrochanteric line. Intertrochanteric line. And in the posterior, it'll be called the intertrochanteric crest, and you have, like going down the back, a linea aspera. Okay? If you go distally, right, what makes a joint are condyles, right? So we have a lateral and medial condyle. Okay? They're only called condyles in the lower extremity, no name, just condyles. And above the condyles, lateral and medial epicondyles. So pretty easy. Okay? And then we got the patella, right, which is a sesamoid bone, it's your kneecap. So the condyles, the lateral and medial condyles of the femur are going to make a joint. They're going to make the knee joint with the lateral and medial condyles of the tibia. Okay, no epicus on that. Okay, but epicondyles in the femur. Okay, and then we have our patella. The shin bone is called the tibia. The lateral bone in your leg is called the fibula. The tibia has a tibial tuberosity here for attachment to the patellar ligament. And if you go distally on the tibia, that bump on the inside of your ankle is called the medial malleolus. Medial malleolus. I'll ask it just like that. What's the distal portion of the tibia? You tell me medial malleolus. Okay, if I ask, what's the shin bone? Tibia. What's the lateral bone in the leg? Fibula. Okay, the fibula, the proximal portion of the fibula is the head. Distal portion is the lateral malleolus. What's the distal portion of the fibula? Lateral malleolus. Okay? Now the two malleoli, right? They're going to make contact with your ankle bones. The first ankle bone is going to be your talus. Anterior to the talus, you have a navicular bone. Anterior to that, you have the first, second, and third cuneiform bones. So you have 3 cuneiform bones in each foot. So you have 6 in the body. And then on the lateral side, you have, it's called the cuboid, because it looks like an ice cube, and then your heels are calcaneus. Then you have metatarsals and phalanges at low extremity. Okay? Let's swing by this again. Okay, so right here you got the shin bone, I'm sorry, the thigh bone is your femur. Okay? What locks into the acetabulum is the head. Okay, then you have your neck, greater trochanter, and lesser trochanter. So if you're looking at posterior, this is anterior, you're looking at posterior, greater trochanter, lesser trochanter, intertrochanteric crest. Intertrochanteric crest. In the front they call it the intertrochanteric line. Okay, then we got like we call a linea aspera. Okay, and right here, right, that little like V, that's a gluteal tuberosity. Your gluteus maximus muscle attaches